We're very excited to be the first office in Berks County to provide Iovera treatment before knee replacement surgery. At the Bone and Joint Care Center, we try to treat people like family. And one of the things that we noticed was that there were a lot of patients that either couldn't have surgery or didn't want surgery because they were worried about the pain associated with it. And we really didn't have an option for those people. And so I heard about this through some journals and then talking to some colleagues that had some experience with it.
It's a treatment that if patients exhausted all options and who don't want surgery or can't have surgery, it helps to lessen that knee pain. Also, we've been trying it on preoperative knee replacement patients to help with the immediate post-operative pain and to lessen that.
Cryoablation's been around for a long time. Before, it used to be these big towers and you had to have a coolant there so that it didn't get too cold. And now literally, this is a small handheld device. The procedure itself takes about 25-30 minutes. What we do is use an ultrasound machine to find nerves, 3 nerves in the thigh, mid-thigh, and 2 nerves on the inner part of the knee. And then once we find them with ultrasound, we numb the area with some numbing medication so the patient doesn't feel anything.
It's minimally invasive. We put 3 needle marks on the thigh and then 2 at the knee. You'll be awake. There's no restrictions after. You can walk out of here, and in hopes it should be immediate relief.
The other nice thing is patients can come in and out. They leave immediately. They don't need a ride, someone to drive them. There's really no downside to Iovera. Most of the patients that we see that are candidates for Iovera have already had injections. So some people might be worried about needles. Usually the majority of our patients have had plenty of needle sticks before then.
We've been doing a lot of preoperative knee replacement patients, and a lot of them have been doing well the first couple weeks.
It helps decrease the amount of opioids that people need. It helps them get out of the hospital or rehab quicker, and it also helps their overall rehabilitation as far as the physical nature of their knee with bending and straightening move a lot quicker.
Even non-surgical patients who may need to lose weight, this really helps with their knee pain, and then they can do that physical activity that sometimes is required to lose that weight.
Other offices, I think orthopedic offices may not even want this. They'd want to send it somewhere else to have this sort of thing done and then come back. But going back to treating our patients like family, that's why we prefer to do the procedure so that we know how it's working, that it was done correctly, and so that people get the best potential outcome. This has been a game changer for our patients in allowing them to have less pain after surgery and get through the recovery process as quickly as possible.